Can you explain to all of us today how sequester impacted research at NIH?
Well, thank you for the question. It certainly was a serious blow to momentum. The $1.55 billion that were taken away from our budget in the middle of the fiscal year resulted in our inability to fund about 750 grants that otherwise would have been funded that year, and those very good ideas basically got left on the table. As you know, we were able to make up some of that ground in the subsequent years, but even in 2015, we did not recover the entire $1.5 billion that was lost in 2013. The results of that, in terms of what they've done to investigators who are already struggling with difficulty in getting their grants funded, really has been quite significant. The overall likelihood, if you send your best ideas to NIH, of having that supported has dropped over the course of the last 10 years since the budgets became flat and inflation has been eroding away at our ability to support research. And it is important to point out, and you've made this point, that this is something which puts America at a limited competitiveness status as well. If you look to see what other countries are doing, I'll just show you a graph here in terms of from 2011 to 2013, in terms of the change in percentage of GDP invested in research. You can see that countries like China and Brazil, South Korea, and so on are substantially increasing their investment. They're reading from our playbook from the 1980s and 90s, whereas we stand alone in this graph as actually losing ground. The consequences of that is we are also losing opportunities for science, we're losing jobs, and we're potentially at risk of losing young investigators who are beginning to wonder whether there's a future for them, and some of them are starting to give up.
And the threat of that sequestration going in again in a few short months, what's that doing to you?
That hangs over us like a dark cloud, because if sequestration is not dealt with, we stand to lose another $19 billion that would have gone to medical research over the coming years, and the consequences of that are really painful to consider.